I was born and bred in Birmingham. I went to Birmingham Medical School and I practiced in the Birmingham area for all these years. What sets Birmingham people apart, I think, is they're very down-to-earth, very hard-working. They are very family-orientated. I know it's an often used phrase, but they're the salt of the earth. It makes my job easier because I am, if you like, a local lad, boy, doctor, individual.
Greg, isn't it?
Yes, it is, yes, sir.
Right, here for Dr. Dudley.
Ooh la la. What a gay, horrible day. Ooh.
Not too nice, is it?
Greg, please.
Yes,
Right,
it's
here
a
we
pleasure,
go.
sir. Can my wife come in and
Absolutely.
bore you to death?
Oh, you can't be saying things like that. Now then, sir, how can I help you?
They phoned me up, was it yesterday, and said your blood tests about, which were very quick.
Yes.
And the doctor would like to speak to you. And I thought,
No. There's no horror stories here. First of all, they did an HbA1c. That's a check for diabetes.
Okay.
It's fine. Okay, so you haven't got that. Mm-hmm. Now then, we've done a couple of other tests. Your urea and electrolytes, really how your kidneys are functioning and what the salt levels are, sodium, potassium.
Yeah.
And we've done a test, your urate level for gout. Now that, essentially, in old money, it's 539, which is quite high, OK?
I know I've got that.
OK. Now, when were you told you got gout, Greg?
Initially.
A few years ago, it came on, it just comes on and goes, you know.
Yeah.
And then this year,
Yeah.
I had a couple of days, bad days with it.
Yeah. Where do you tend to get it, Gregory?
So,
So it's the classic site, the big toe.
The only one I'm worried about is the drink.
OK.
Red wine.
Cut to the chase.
Don't.
What are we talking about, red wine-wise?
A lot of wine. We spend a lot of time in France now. We're retired, and it's the wine world.
So, where I think we should be with this is, we should first of all say to you, OK, well, try and cut down if you can.
Yep.
It would be beneficial.
It's easily done.
One of the things about gout is painful joint, big toe, etc. The other thing you've got to remember is it can crystallise in your kidneys, OK? We wouldn't want crystallisation in your kidneys, kidney stones and all sorts of problems that ensue. We should first of all say to you, OK, well, try and cut down if you can.
Yep, I can do that, no problem.
But I think that's where we want to be. Now, what I'd like to do is to say, right, in 3 months' time, we do it again. Whether you've got gout or not, if it's still high, then we could say to you, well, all right, look, despite best efforts, this is still high, and therefore it will be a good idea to consider a medication like allopurinol to bring it down. Well, where we need to do now is to obviously review your kidney function and your uric acid, and you're going to look at, shall we say, your red wine consumption and reducing your...
Yes. OK.
Is that a deal?
Yes, sir.
Oh.
OK.
She's gonna bully me now.
She doesn't look the bullying type to me, but,
Well,
you know.
I will.
So we come back from,
No, don't go and ruin it.
come back from France and we got enough wine to last us till April.
Right.
Limit.
Make it last you
Until April.
Mate,
No, the next April.
lovely to
Okay.
Lovely to meet you, sir.
And you,
It's been
Very
a
nice to
take
meet
him
you.
home, will you,
One of the
please?
Yes, I have been
sanest
listening.
doctors I've
I have
ever
been
met.
listening.
You've got to say that. Come on.
You're one of the sanest doctors. You're on my wavelength, man.
Okay.
Cheers.
Thank you very
All
much.
right.
Thank you for your time.
Okay.
Mr. Raj,
All right, yeah? How you doing? All right, so yeah?
not too bad. Do take a seat.
Thank you.
How are you today?
It's chest infection still.
Yeah?
I had them antibiotics.
Okay.
Finished them. They ain't
When
got
did
rid
you
of it.
finish them?
2 days ago. But now, you know, when I'm coughing,
Yeah.
I started coughing up bits of blood.
You started coughing blood. Okay.
You know what I mean?
So going back before you had the antibiotics, how long were you coughing for?
Oh, I've had this now for about 3 weeks.
You had it about 3 weeks. Okay. Are you a smoker at all, Mr. Raj?
No.
Have you ever been a smoker?
Oh, years ago.
And you've not had a recent chest X-ray at all, have you?
No, I don't think so, no.
Okay. So I can hear your breathing
wheezing.
not 100%.
It's worse of a night, you know, you lie down.
Yeah.
But you know what I've been doing? I've been sweating a lot.
Have you?
Yeah, hell of a lot.
Is this just since recently or even before the cough?
I had that cancer, didn't I?
Yeah.
And I've been right since then.
Okay. So when did you start sweating like this?
Well, now, I mean, I'm tacky now, you know what I mean?
Yeah.
It's got worse the last 3 weeks.
We'll have a quick listen. What do you do for a living?
I'm not working at the moment.
Okay. What did you used to do?
Motor trade, tinker with cars.
Okay.
Yeah. I used to do roofing when I was a lot younger. We used to look, but it was probably stripping asbestos, but we never knew what it was at the time.
You think you were exposed to asbestos?
Yeah, it was
possible.
asbestos. Yeah, we used to strip them, but you never knew back then.
How can I help today?
I feel like I'm struggling to breathe.
Do you get wheezing at all?
Not right now.
Do you have any pain in your chest with it?
My ribs are sore through coughing.
Can I have a quick listen to your lungs?
Yeah, sure.
Can I go up the back?
Yeah, carry on.
Sorry, cold hands.
Okay.
So, big breaths.
Your lungs sound normal.
Your lungs are absolutely clear.
Are you feeling a bit better about it?
Yeah.
All right.
Okay, thank you.
Is there any family history of any lung conditions?
Yeah, my dad.
What did he have?
You know what the miners get when you're hard to breathe?
Yeah.
Our dad had that.
Yeah.
It took some of his lung away, I think it was.
Oh, gosh. Okay.
Yeah.
So you've got a temperature still
Have
today, 38.1. So this is, you're still hot. So let me
That's
have
probably why I keep sweating, isn't it?
Yeah, so it's not cleared. So let me see.
Well, I ain't been right, you know. When I had that cancer thing,
Yeah.
if there's anything going, I get it. Do you know what I mean?
Your
I think
immune system.
my immune system's
yeah, it's
smashed
not
up, innit?
100%.
No.
Are you up to date with all your vaccinations and things?
Which one? What do you mean?
The COVID, the flu? No?
No.
Why not?
I don't want them. I ain't putting that rubbish in me. No
You're
chance.
at high risk.
I don't care. I'll take my chance. I ain't having that. One of my mates had it and he died.
You know, the problem is, we have that even with the flu jab. We have it with the jabs.
I
with
know,
the
my man
kids.
didn't knock to the bed, the flu jab.
Yeah, but
I don't fancy
I think the problem with the COVID thing is because it's brought it to the forefront of everyone's awareness. There's certain people who've got complex medical conditions. If you were to get COVID, you'll be at very, very high risk. You're the types that will end up, you'll end up quite seriously ill in ITU. The vaccine, if you look at it, is more safe than it is unsafe.
I know what you're saying.
Yeah.
No, when my mate died, I mean, he was all jabbed up and everything, and he bang.
But that's to say, like, sometimes, like, non-smokers get lung
I know
cancer.
what you're saying, yeah.
Those are the one, because I think it's close to you, so that's why it struck you hard. But the hundreds and thousands of people that it saved.
I know what you mean. I'll have a think about it.
Have a think about it, yeah.
If you ate good grub, you know what I mean, vegetables and salads and proper food, you shouldn't have to have all this, should you?
But this might be something else.
Well, I know.
If it was as easy as keeping a good diet, I would have been rich fighting COVID. I could do a package, a shake or something.
Yeah. I know.
Have you tested for COVID this time around?
No.
Okay, all right.
What could that be that then?
It could possibly. Perhaps that's why antibiotics have not cleared it.
Okay.
So your blood pressure is a little bit high. It's important for you to come back once you're better to get the blood pressure checked. I'm just going to lift your top up so I can have a listen. Got interesting tattoos here. Deep breaths.
Yeah.
Okay, still very bad. You still got a brewing chest infection, 100%. So the antibiotics has not shifted it. You know what makes me a little bit anxious is this history of you being a roofer and working with asbestos. So I thought, that long gone are the days of the ship industry and things like that. So those people are much older. I forget about the roofing industry. So I want you to have a chest X-ray.
All right,
Yeah, we'll do that just to make sure that everything's okay.
Yeah.
But the infection's there because your temperature's still high, your lungs so crackly. So I'll give you a second course of antibiotics. If you do not get better with antibiotics, come back and see us.
All right, no worries. Yeah, thank you.
Was there any questions?
No, bang on and just get it done, innit? All right, nice one. Thanks a lot then. Nice one.
Take care.
Thank you.
Bye-bye.
Cheers, man.
Right, what can I do for you?
Okay, basically I had a tattoo on Friday.
Right.
And it's kind of been infected.
Okay.
I went to the walking centre to get a prescription to get antibiotics.
Yeah.
But earlier it's just like, it just hurts more. It's like more red, it's more like, it feels more tight.
Okay.
And I feel like it's going a bit purpley as well,
Okay.
like, so I just thought I need to get it checked out.
Sure.
Yeah, I need to get it checked out.
Okay. And so the pain's got a lot worse. Are you taking anything for pain?
No, I ain't been taking nothing for pain.
Okay.
No,
Any particular reason? You're hard.
To be fair, you know what it is. I don't like taking like paracetamol, ibuprofen or things like that.
Okay.
But obviously, looks like I might need to start.
Okay,
Like, you know what I mean? Because it is hurting.
Yeah. And has it been discharging at all, or oozing, or bleeding?
See, it's hard to tell because it's scabbing, but you'll see in a minute. Like, I feel like it's pussing a little bit.
Okay. Okay. So we'll check your temperature first, if that's all right.
No problem.
So which is your favourite tattoo?
Probably my chest tattoos.
Okay, what's on your chest?
I've got the Queen.
Right.
Off the £50 note, and then I've got the $100 bill sign on my other one, kind of facing each other off kind of thing.
Yeah.
Yeah.
So your temperature's fine at the moment.
Okay. See, I do feel hot, but
sometimes we can, but not have a temperature. Okay, I'll just pop this on your finger. It measures your oxygen level and your pulse rate.
No problem.
Right, let's have a look at this tattoo then. Right, okay.
See, I feel like, is this the pussy? Or I ain't got a clue though, but but it's like this, the spreadness, and I feel like it's going purple underneath here.
Okay. Yeah.
It's quite hot as well. I don't know if it is now.
Yeah,
but it has
right,
been quite hot.
So it's quite red and inflamed, okay? So I think you definitely need the antibiotics, all right? But we need to give them a chance to kick in, all right?
Okay.
So they're going to take at least 24, 48 hours to kick in.
Yeah.
You haven't got a temperature and your heart rate's normal, so that's good.
Okay.
So keep an eye on it. It's very inflamed around there.
Yeah.
So if the redness goes up beyond there, or down to there, so that sort of margin.
To be honest with you, yesterday it was up to my elbow and it was round to here, but it's wearing off now.
So that's really good. Okay.
Yeah.
So I would suggest carry on with the antibiotics and take some regular ibuprofen. Okay.
Is there a cream I can put on it? Because when I'm putting my cream on, it's making it sore and worse. It like kind of bubbles up and stuff.
What you could try and do is put some ice on, like cling film or plastic or something, and ice on top of it.
Yeah.
Don't put ice directly on it because it'll stick to it. Okay.
Yeah. So I'm just gonna have to deal with the pain then, and
Well, no, I think take the regular ibuprofen.
Yeah.
Okay, because that works as an anti-inflammatory and a painkiller.
Okay.
All right.
Yeah.
And if that's not enough, then you can take some paracetamol as well.
Yeah, we'll go with it then. We'll go with it.
What are you gonna get done next?
Well, I was just gonna get the rest of the NBA logos going up here around my arm, kind of thing.
Right.
And stupidly enough, I rang him the day after and went, "Can you finish that off today, like?" He was like, "I can't fit you in." I thought it's a good job because on the night it started to go like that, like, so it probably would have been a bit worse if I got that, wouldn't it? So maybe I just don't have tattoos anymore.
Maybe. I can't see that happening though, can you?
Nah. Nope.
All right, so make sure, the important thing is to take the antibiotics really regularly, okay?
Yeah. Okay, wicked. Well, we'll go with that then, and I'll just...
Okay,
thank you for
nice
your help.
to see you.
Thank
Okay,
you. See you later.
bye-bye.
Bye-bye. So, mate, all right. See you later.
Come in, please.
How are you?
Hello, do come in. Have a seat. Now then, sir. How can I help you?
If I wee or whatever, so it'll just come out afterwards again with a bit more persistence, whatever.
Okay.
And if I just push up here, it'll just seep out.
Okay.
Some nights I'll get up 4 or 5 times to a week. So obviously I'm borderline diabetes.
Okay.
So that
yeah.
I'm very dry in the mouth, so I tend not to drink as much, and I decide not to go.
What's the stream like when you go?
It's not much, especially when I'm going at night.
Yeah. When you were a younger man,
Yes,
forgive me,
yeah.
but when we were younger men, right, you're saying that the power isn't there.
Yeah, as much as
Okay.
Unless I've been down the pub and had a few beers.
Okay, and then it's a bit more. But now, very commonly, as you get a bit older, the prostate gets a bit bigger. And because it sits at the base of the bladder, it can mean that you can get incomplete emptying. So instead of, 500 mils is the usual sort of volume for a male bladder, you might find you only do 200. And then it stands to reason, if you have already got 200 in your bladder, it fills up quicker. So that's why you want to keep going. People worry about cancer of the prostate. But more commonly, you get what we call benign prostatic hypertrophy. Forget the fancy term. It's the description I give you of it getting bigger.
Okay.
A blood test can be useful in diagnosing cancer of the prostate. I'll do your bloods today.
Brilliant.
And I'll examine your prostate. Are you okay with that?
Job done.
We do it all out of 2 tubes, you see, so it's nice and easy. What sort of work do you do, Gabby?
Engineering.
Done it long?
Yeah, long.
Fair few years.
Yeah, it's kind of repetitive.
What do you do by way of hobbies?
Music.
Yeah.
Yeah.
Play or?
Play.
Yeah.
Yeah.
What do you play?
Drums.
Great. I'm sure you've got. Have you got understanding neighbours?
Don't need them because it's. I've got electronic kit, but.
Yeah, you can do it all with that. Okay, that's great. Have you done it in a jiff?
Yeah, no worries.
So how long have you been playing the drums?
Oh, you're too long. 50 odd years or whatever. So.
What sort of music do you like?
R&B, rock.
Ah, good.
Yeah.
Right, can you press and bend? Just bend it up so as it doesn't bruise, and I'll get these in the tube. I'll put your plaster on.
Yes, brilliant.
There you go.
Well, good job there.
I'm just going to pull the screens back now. If we lie you down, facing the wall, with your knees tucked up slightly.
Okay.
That's great. So, just relax and I'll be as gentle as I can, all right?
Okay.
That's fine. Is that very uncomfortable?
No, that's all right.
Not too bad. Well done. That's fine. That's great. Do you want to stick yourself back together again, and I'll discuss it with you?
Brilliant.
I'll just leave you to get yourself sorted.
Brilliant.
And then come out when you're ready.
Okay.
Right. First of all, if you look at your prostate gland, it's big, it's smooth.
Okay.
So I think it's a benign or non-cancerous enlarged prostate gland.
Okay, that's good.
So, what I'd then like to do, and I'll arrange it for you to have a follow-up appointment with the PSA test in about 10 days' time.
Okay.
We can then discuss what we can do about it, because there is treatment for it.
That's brilliant.
Is that all right?
Yeah, brilliant, yeah.
Nice to meet you.
Beautiful. Well done.
Okay.
Really appreciate that.
Not at all.
Thank you.
Okay.
Mr. Deferidge.
That's me.
Come on in, please.
Thank you very much.
So, I believe you're here about your knees.
I am.
In the hope that we will do a steroid injection into them.
Yeah.
So how's the right knee at the moment? Is it
Well,
giving you pain?
that can, no, it's not so much painful, but it can sort of collapse, you know.
Okay. So it's starting to give you trouble now as well? Yeah. Okay. So, I wonder if I could pop you up on the couch and just have a look at your knees first.
Yep, okay.
Just so that we make sure that
Fine.
I'm happy that that is the best course of action today. You know. You can use that step if you it's easier for you to get up.
Well, I was actually racing motorcycles up until 4 years ago.
You were racing motorcycles?
I can't get my leg over one there.
Can you not? Oh. Right, bend your knee for me. Yeah. There's
crunching.
Bit of crunching in there. Any pain along here?
No.
No, that's all okay. All right, so let's have a look at this one. Any pain with it?
Yeah.
Bend it up for me.
Crunch.
Now, stay there for a minute. I'm going to get the injections ready.
Thank you.
So what sort of motorbikes did you race?
I used to race a lot of classic, old British classic stuff.
Right. So how big were the engines?
500cc. Bounced down the road a few times, unfortunately.
I think they call that road rash, don't they?
Yeah.
Well, you're still here to tell the stories. Martin came to see me because he was having pain in both of his knees. He'd previously benefited from having steroid injections into them, and he was keen to have that intervention again to see if we could get him a bit more mobile. Right, if you don't like needles, now's the time to look away.
No,
Do you just
I don't mind needles.
Just try to relax, keep that as relaxed as you can. Decent amount of arthritis in this one.
Yeah.
The needle's not. Oh, try to keep your legs still for me. You okay?
Yeah.
There's the space between the big bone in the thigh and your shin bone here is where we are trying to put the needle. And when you've got arthritis, that space basically gets smaller.
Smaller.
So that's why it was a bit tricky to get the needle in.
Yeah. I ain't felt the pain like that before, I must admit.
Yeah. Right, that's one done. Switch over to the other side. You just stay still.
Gone quite hot, actually.
It is quite warm in here. You feeling okay?
Yeah, just a bit hot.
Right. Well done. Yeah, it's much easier when first time. 3 seconds and it's all over. There you go. Well done. You all right?
Yeah.
You're feeling a bit... Hang on. Lie yourself down. There you go. Come this way for me. Come this way. Here we go, sir. Jamie, can I get a hand?
Yeah, of course.
Here you go, sir. It's all right. Lay yourself down. Jamie, can I get a hand? How is that? You all right, sir?
Yeah.
All right. You fainted on us there?
Did I?
Yeah, you did. It's all right. We got you laying down.
You're all right.
Being better. Let's try and get you on your back a bit more.
Just when it was
Trying to lower
hot.
the head in.
That's all right. Well done.
You sure?
Bend your knees for me, sir. We're just going to try and lift your legs up a little bit, try and get some of the blood flowing back to your head. It's a bit warm in here.
Yeah, just when it was
Not a surprise at all. All right?
Yeah.
The most likely explanation is that Martin's fainted, but obviously we need to check it out and make sure that nothing else more serious has happened, like, a stroke or a heart attack. We just want to make sure that he's okay. Have you got any pain anywhere, sir?
Have you got any pain
anywhere in the chest at all or anything like that?
No.
Do you want to take this off?
Yeah, let's try and cool you down a little bit.
Yes, it's up.
There you go. Fainting's really common, and there's several different causes for it, but the most common one, and what is the case with Martin, is there's a slight reduction in the blood flow to his brain, and his brain's telling him he needs to lie down.
You back with us? Your colour's coming back.
No, I'm back.
Good, good.
I'll be back. Is that okay?
Yeah, his blood pressure's spot on. It's perfect. All right. Definitely no pains in my chest.
No.
Breathing's
It was
okay?
a pain in my knee, the first one.
Right.
That really,
You think that's what got you?
Yeah.
What we're going to do, sir, we're just going to make sure you're feeling okay.
Okay.
Give you plenty of time to recover. You can finish drinking that if you like.
Sorry about that.
That's not for you to apologise, sir. Don't worry.
Well, I didn't know nothing.
Don't worry.
I didn't know nothing about it, did I?
Sorry?
No, you didn't.
I didn't know nothing about it.
You didn't
Well,
know
you did
what was
ask me out for
happening.
dinner next Tuesday, but... No, joking. Right.
Yeah.
You feeling okay?
Yeah, fine, yeah.
Are you feeling nauseous at all, like you want to be sick?
No.
Good. All right. Let's let you
me
up then.
to hold that?
How are the knees feeling, by the way?
I don't know, yeah, I ain't tried them. Yeah, that's okay. Yeah, I feel okay.
Knees feeling good?
Yeah, feeling
All right. Yeah, I'll carry this for you. I'm going to come with you.
Okay, thanks.
Make sure you get somewhere where we can sit you down again. Mind your step, sir.
Be careful.
Right, I think we're heading this way.
Well, my knee feels better.
The left one?
Yeah, I'll let you know. Yeah,
Yeah.
it does actually.
That's a local anaesthetic.
Oh, yeah.
Yeah.
He's gorgeous.
Thank you. It's really lovely when he's sleeping like that.
Come on then.
You cheeky you are. You're cheeky.
Can I have your phone,
No. Oh, thank you very much. It's very kind of you.
Excuse me, cheeky.
Oh, careful. Are you measuring yourself on there?
Yeah. What if it falls over your head?
Good boy.
What if it hits your eye?
What if you stopped with all the questions?
And you guys are doing a great job, by the way.
Thank you.
Right.
I'm still alive.
later.
Bye-bye.
Bye. Well done.
Are you dancing?
Alfie John, please.
Yeah, come on. Come on.
Hello, handsome. Come on in. Come and take a seat. My name is Dr. Raffi. And who have we brought with you? Who's this?
Mum.
Mum. All right, okie dokie. Can you tell me what's the matter? Oh, is Mummy going to tell me? Mum going to tell me? OK. Go on, what's been happening?
He had a cough. It started off as a cold, but it's been there for 3 weeks now.
Oh,
and it's
dear.
showing no signs of shifting.
Yeah.
I am adamant that he's got asthma because
right.
every time he runs,
Yeah.
every time he's doing something.
Yeah.
But recently, in the night, he's waking up and he's choking with it.
Oh, goodness, right, OK. And what makes you say asthma? Have you got any asthma in the family, or is it something that you've come across?
My oldest son, when he was younger, they give him an inhaler, but he doesn't have to use that anymore.
All right, yeah. And was that for a similar thing in terms of was he coughing at
same,
night time
but
and
he's
things like that?
worse.
Oh, you feel like he's worse?
Yeah,
All
a
right.
lot worse.
No worries.
Mummy.
We can go in a minute, OK?
Is he otherwise fit and well? He's not had hospital episodes or anything like that?
He was on steroids as a baby. We was always in and out of hospital.
Oh.
Every cold that he gets seems to affect him 10 times worse.
OK. Right then, Alfie, shall we have a look over you? Is that OK?
Yeah.
So what we're going to do first is I'm just going to try and find any tickle spots that you've got here. Have you got any tickle spots? Let me see. Any tickle spots there? Any tickle spots in there? Oh, you got no tickle spots? Oh, dear.
He's so stubborn.
That's all right. Now, do you know what this is for? It checks your temperature. Do you know where it goes? No.
Goes in here.
In your ear. So you look at Mummy, and I'm going to check this ear. Good boy. Well done. Fantastic.
Oh, God, don't fall over that. I've dropped my stick.
Oh, no worries at all. Let me grab it for you.
Thanks, it slid off there.
No, don't worry at all.
Mrs. Christine Davis.
Come in.
Do take seat. Are you okay there?
Yeah.
So tell me what I can do for you today.
I've had this reoccurring urine infection now for over 12 months and nothing seems to work.
Yeah.
So
Yeah, it's a bit cloudy, isn't it? Let me just grab a pair of... So I was looking at your notes. You're having lots of this.
Yeah.
And every single time it's getting a bit more tricky because the antibiotics that works becomes a bit limited.
Well, that's what I was worried
let me
about.
just squeeze in so I can test this at the sink. But how do you know that you've got a water infection?
Wetting myself all the time, which
Okay.
is awful.
Okay.
You know. And
any pains or burning?
Yeah. But it starts there.
Yeah.
You know, where
Starts
you
near
get
your lower
it.
tummy, yeah.
Yeah. And then it goes down my arms into my hands.
Into your hands?
Yeah.
That's quite
Hands,
far.
I know, nobody's heard of it before, but I can assure I have it. It goes into my hands.
It is coming up with every colour of the rainbow. It is definitely an infection. You know, the last time they wanted to pop the camera in, you had an infection.
Yes.
Have they managed to rearrange that?
Yes. And then he said, I can't do it because if I put the camera up, it might push infection up into your body and you get sepsis.
I can see you're getting these significant infections almost every
They
month.
never go.
They never go.
And I wondered if it's anything to do... These chairs are the most uncomfortable things if you've got fat legs. I wondered if it was anything to do with the prolapse. I've got
Yeah,
massive
I was just going to
prolapse.
say, because you've had a hysterectomy and they took out your womb and your ovaries many moons ago. And then I think you've got quite a severe prolapse. And what you have to remember is at the front of what would have been your womb is your bladder. So if you've got quite a degree of prolapse, that's probably pressing onto your bladder. When you go for a wee, you don't completely empty it. So then you're prone to getting infections. So I think that's a bit of that. And you've tried the shelf pessaries. They don't really work, do they? They've come out, the pessaries.
Yeah.
So
I had the choice of hospitals to go to and I
Yeah.
picked Little Aston because of the parking.
Yeah, it's quite posh as well.
Get a coffee.
Yeah.
And And she tried every ring she'd got.
Yeah, they all didn't stay. So there are two things here, really. One is your current infection. We need to treat that. But then we're going to put you on a very low dose antibiotic that you take every day. We don't really like to do that because the longer you are on a particular antibiotic, you build what we call resistance.
Yeah.
So eventually there will be lots of antibiotics that won't work with your infections. But I think you need to be on a baby dose of antibiotic every single day, whether you've got an infection or not. Because otherwise you'll never get your camera up and we'll never know what's happening in the bladder.
Yeah.
So what I'm going to do, I'm going to give you a course of antibiotics. So you'll have 2 lots of antibiotics. One will be just for a week. There'll be another box. It will be enough for 3 months.
Yeah.
So it's almost like a maintenance. You know, like you've done the service.
Yeah.
You put a bit
I
of
think
maintenance.
I had that once, you know,
Yeah.
a long time ago, and
Did that work?
and it worked.
Okay. So
It
we'll try
worked.
that. We'll try that.
Yeah.
So a few things to be done.
Yeah.
But first things first, I'll
Yeah.
send that off. So
Yeah,
you'll
I'll
get
go-
2
I'll
lots
go
of
in.
antibiotics.
Yeah.
One to take for the week and the other one's maintenance.
Thanks.
Okay?
Yeah, thanks. We're going to get off this chair.
You're all right, let me.
Yeah, no,
Do you need
don't.
help?
Don't. That's it, done it. Oh, thanks ever so much. Can I come to you permanently?
Of course. There you go. Always a pleasure. Thanks.
Thank you. Bye. Bye. Can I leave the door for you?
Of course, absolutely. That's absolutely
Thank
fine.
you ever so much.
So what I need to do is I need to have a look in your mouth now. So can you do a nice big ah? Nah, I can see your tongue, but I need to have a look at that back.
Open your mouth.
Good lad.
Open your mouth.
That's all right, don't worry. And a nice say ah. Good boy. Well done. Fantastic. Give me 5. Good lad. You are an absolute star. Thankfully, I mean, it doesn't sound like a chest infection at the minute, but all of here is very, very congested and red. So that's where the cough is coming from at the minute. So it's coming from up here.
Okay.
His tonsils looks absolutely fine as well.
Okay.
So basically, what happens is he's probably picked up a school bug, viral infection, etc. So with regards to the nighttime cough and the coughing when he's running around, I'll prescribe a blue inhaler and a spacer for you.
Okay.
And give it a trial. Now, in this age group, very difficult for us to say that they've definitely got asthma. They're more likely to have something called viral-induced wheeze or viral-induced cough, which means that they've picked up a bug, irritates the chest, and they need an inhaler for a little bit.
Okay.
And then, again, like you found with the croup... Sorry, Alfie, what were you saying?
Need to wait.
Oh, dear, oh, do you? OK, I'll make it quick, So, like you found with the croup, he might grow out of it.
Okay. Thank you.
All righty.
Wow.
Superhero sticker.
You love stickers, don't you?
Because you did so good.
What
That's
do you
for you.
say? Say thank you. Good boy.
All righty, go and have a wee.
Come on then. Thank you for your
take
help.
care.
Bye.
Bye, Alfie John. Bye, Alfie.
Say bye.
Bye.
Bye, be good.
What was it we could do to you?
I'm suffering with, I believe, trigger finger. It tends to be more at night when I wake up in the morning and my finger will be locked like that.
Okay.
And sometimes the only way that I can release it is to actually...
Physically pull it?
Physically, yeah, pull it. And it kind of goes with like a bit of a clunk kind of thing.
What do you do for a living?
I'm a delivery driver.
Okay. So using your hands a lot generally?
Yeah.
Do you mind if I just have a look at your hand for a second? Thank you.
And you can feel that.
Yeah, there's a little lump in there, isn't there, which is the issue with the trigger finger.
I have got type 2 diabetes, which I think is kind of causing a few other issues at the moment through general life stresses, suffering with depression. My eating has been quite out of control, comfort eating, which has caused sweats. I get very itchy when I sweat, and now my finger, so I don't know if it's all connected or...
Yeah, well, I mean, obviously diabetes is one of those illnesses that can affect lots of different parts of your body, and certainly if it's not being well controlled at the moment because of, as you say, your eating habits, and that's going to start having wider impacts, isn't it? The trigger finger in itself isn't a direct link to the diabetes, but obviously is just one more thing on the top of what sounds like a big pile of things that you have to deal with at the moment.
Yeah.
GP appointments are unfortunately painfully short. 10 minutes is not a lot of time to get a lot of information. As GPs, we often have to be on the lookout for that hidden agenda, the thing that the patient really came in to talk about. So listen, with the trigger finger, it's very straightforward. You either put up with it, or at some point we try a steroid injection into it to try and reduce the swelling of the tendon there. Do you want to spend some time talking about your mood and how that's affecting things generally?
Yeah, my mood has been quite low. Going through divorce at the moment. I kind of just feel like I'm in a rut, not particularly in control of any aspect of my life. I am on antidepressants, but I'm still having to, because of obviously the cost of living crisis, I'm still having to live with my ex.
Yeah.
I tend to eat and play the PlayStation quite a bit as like escapism. So I don't know as well if that's having a knock-on effect on my finger as well. So
I suppose you're,
So
you're in that position a lot, aren't you? You mentioned about not feeling in control of things. Sometimes the things that we can take control of are things like our diet and our exercise.
I have been doing like regular exercise, but I still feel, quite low and.
And in terms of looking for any CBT going forward, have you been signposted as to where you might go to get that, or?
No, I'm in like a psychology group, so I wasn't quite sure if me trying to get CBT would affect that group.
I imagine the two would be complementary rather than being at odds with each other. So I think it is something that I'd be happy for you to do. And if that service is under the Mental Health Trust, then they might be able to signpost you to a service within that. Talking about mental health is a taboo subject, and I think in my experience, men are even more reluctant to come forward and talk about their mental health. What was really nice to hear, though, is that he'd already gotten a lot of help. He was on medication and he'd been referred to a group therapy session, which he was finding useful. And he came to ask me about CBT, cognitive behavioural therapy, which is another way in which he might be able to help manage his mental well-being better. It's difficult sometimes when life is not turning out the way we want to. There's no quick fixes, unfortunately, is there? And I know that's not a great place to be. So I sympathise.
Yeah, and then waking up in the morning with my finger.
Yeah.
Come on, give me a break, please.
Well, look, with the finger, more than happy to try the steroid injection if you want. Do you take any medication then for the diabetes?
No.
Okay, fine. All right, my computer appears to have frozen up.
I seem to have that effect on people's computers.
I will not allow you to blame yourself for that one. I will sort out a blood test for you, because we need that, because that's the information we need to sort of help trying to get diabetes back, to understand where it is. Book in to get that finger injected. And then you probably need a follow-up appointment again after you've had the blood test. At that point, we can refer you for some CBT. Okay?
Yeah.
Great. We covered a lot. How are you feeling?
Yeah. Okay. Yeah.
All right. Well, I'm glad I've been of some help. All right?
Thank you very much.
Great.
Yeah.
All right.
Okay, that's great. Thank you. Thank you.
All the best.
All right. Bye.
I have to say, you look fantastic for your 91 years.
Oh, thank you.
I love your shoes, Nancy.
Lovely blue eyes.
She's a very good baby.
I love that your stick matches your shirt.
I never thought of that, till you just...
It's great.
You look very well and too refreshed to have a 2-week-old baby.
I got like when I had no time this morning, I was like, oh no. You don't see many people in the same colour trousers.
Oh, there you go.
There we go.
We have excellent fashion sense.
Love your bag.
It's a bit tatty now. I did love it at first.
Oh, it's great.
Hi, is it Michelle?
Yeah.
Come on in. Come and have a seat. Right, what can I do for you?
I've got a fungal nail infection.
Right, okay.
I had the blood test done now.
Right, okay.
Do you want to see?
Yeah,
pretty
possible.
obvious.
So how long's it been there for?
About 2 years.
Right, okay. Oh, that's a good one. Yeah.
And
okay.
it actually started in that one and then
yeah, okay, fine. Just this foot?
Yeah.
Right, let's Right, so clinically, as we say, it looks like it, and because it involves more than one toe, we generally say people need to have the oral tablets, okay? And it takes some time to work.
Yeah, and I tried the stuff you can buy over the counter, and I used that for over a year, and it made no difference whatsoever.
Right, okay,
It was
so
probably worse by the
okay, so what we prescribe is something called terbinafine, okay, and most people tolerate it very, very well. There is a low risk of causing very low risk of causing liver problems. That's why we check a liver function test first. Yes, I would suggest we start it for a couple of months and then repeat the blood test, okay, and see how you get on.
Yeah, that's fine.
Does that sound okay?
Yeah.
So let's hope we can get it sorted by next summer, right? So you can wear open toe shoes.
Yeah, bridesmaid next year.
Oh, are you?
Hopefully.
So we started looking at dresses and things.
Yeah, we went last weekend. So.
Found anything?
Yeah, it's green. It's got sort of cap sleeves for length, kind of pulls in below the bust. So.
Oh.
Yeah, it's fun. She's my best friend. So
Oh,
I'm
that's
looking
lovely.
forward to it.
So you've got to get your nails sorted by next
so it
summer.
needs to be sorted before then.
That's very important. Well, hopefully it will do. Yeah, by next summer we've got plenty of time, haven't we? Yeah. Okay, I'll send that prescription there now.
Thank you
Okay,
very
nice to see you.
You too. Bye bye.
Bye.
Right, yeah, well, thank you very much indeed. Thank you. Bye. Okay.
Thank you.
You're very welcome.
Cheers, thank
Okay, nice to see you
And
both.
bye now.
Bye-bye.
Can you say bye, Fred?
Bye.
Bye-bye, sweetheart.
Thank you.
No problem.
Nice to meet you.
Nice to meet you as well. You take care. I'm glad to see you doing so well.
Thank you.
Bye-bye.
Take care.
Having done the job for 40 years, I describe myself as old school, but I try and instill in medical students and junior doctors the importance of eye-to-eye contact. You don't want to be consulting with a doctor that's hunched over the screen and not listening to you.
My mum died because she was over 20 stone, and I don't want to go down that road.
The next step really is to do a prostate examination and prepare yourself to get that done.
It doesn't matter whether you're a man, woman, child, we're all equal. We've all got feelings.
100%.
We've all got a heart.